Rosacea is a chronic skin condition that affects more than 3 million Canadians, with a slightly higher prevalence in women than men. It can cause persistent redness, visible blood vessels, and in some cases, acne like bumps or pustules on the face. Today, I'm joined by Dr. Christine Palmay, a family doctor from Midtown Toronto, who is here on behalf of Care to Know to help us understand this common skin issue and the available treatments. Welcome back, Dr. Palmay.
Happy to be here, Candace.
Can you start by explaining what rosacea is and how it affects the skin, particularly the middle portion of the face?
Yeah, so rosacea is, so just to be clear, it's not acne. I'll start by saying what it isn't, often misdiagnosed as such, but it's an inflammatory condition of the skin, typically cheeks and nose area. It can happen on the forehead, on the chest, etc. And exactly what you said, you described it very well. It's almost like broken little blood vessels, a red rash, sometimes can feel warm, but is so underappreciated in how it affects patients and misdiagnosed. Acne treatments, while there's a bit of overlap, and to be fair, acne and rosacea often exist together, which adds to even more so to the confusion. But because people are misdiagnosed or don't understand the condition, they're not being treated. And the burden of the disease is huge.
And why is it more commonly diagnosed in women? Does it have anything to do with maybe the cosmetics we use or skincare products?
So, cosmetics can trigger absolutely a rosacea attack. Other triggers like alcohol, heat changes, and sometimes the triggers are very personalized and differ. But it's really hormonal too. I have a number of patients depending on their menstrual cycle, when they're going through perimenopause, postmenopause, etc. Those hormone fluctuations often also increase the incidence.
So obviously there's a very physical side to
Mhm.
rosacea, but there's also a psychological side to that. So can you talk about the emotional toll this takes on people?
People just are embarrassed, right? They don't go out, so there's social anxiety. There's body image issues, especially in younger patients. We know how acne sometimes affects patients. Well, rosacea is often the same. And I think because patients are often misdiagnosed and not treated appropriately, they never have clearing of the skin. So, it just perpetuates their anxiety and their frustration. Quality life measures, it's actually quite shocking when you look at it. People are depressed, anxious, and like I said, not partaking in life activities.
And so treatment options then, I'm going to assume, is a mix between lifestyle changes and medication?
Yeah, so the first thing is looking at making a proper diagnosis, right? Understanding the difference. Like I said, you may still have acne that may be treated separately, but you really have to clinch in the diagnosis. Number two, a good skincare regimen. So, this applies in general. Make sure you are washing, not overwashing, moisturizing, and providing SPF because sun exposure can actually trigger rosacea, heat changes, etc. Lifestyle changes are interesting because they differ. So finding out your triggers, whether it's alcohol, in some cases, different forms of exercise. I had a patient that had to stop hot yoga because she would just, her rosacea would flare afterwards.
Hmm.
So, that's counterintuitive. You think that yoga would be helpful health-wise, but for her, it was the opposite. Managing stress in a way that makes sense to you. Those are the big ticket items. Sometimes people have reactions after having sulfites or a salty food or chocolate. It's a bit of a search and rescue though, so you have to spend a bit of time investing in understanding your personal experience.
And can rosacea pop up at any time, or is this something we typically acquire or get earlier in life?
And it can happen at any time. Typically, like I said, during hormonal shifts. So when a woman's starting her period, during the perimenopausal period, sometimes as you're going into the postmenopausal period, that can happen. It really, though, can happen at any time.
Okay, so if people want to know more then about rosacea and the treatments available, where can they go?
Yeah, so the first thing is making sure you're informed and empowered. And like we've always said, misinformation is en masse. It's pervasive nowadays. So caretoknow.ca. It's free. You sign up. There's a website with a plethora of information, not just about rosacea, but other healthcare conditions. Information arrives to your inbox. The most important thing is that there's input from medical experts like myself. The information is updated, right? You always want to make sure you're marching with the times as information evolves rapidly. Credible information is hard to get these days, and your health is so essential. Make sure you know where you're going and browse safely.
And just before we end, because I'm more curious now, is does rosacea, can you eliminate it, or is it something that will
Mm.
always be with you once you get it?
Great question. Thanks for asking. It's a chronic condition, so it has to be managed, which means there are times where it's worse, there are times that they're better. And medications often are geared as such. Some medications we use during flares, some are used for maintenance. We have orals, we have topicals in a wide variety. But it is a chronic condition, so don't fatigue. Rally on, and we do have good options available.
All right. And of course, you go deeper into this issue on whatshesaidtalk.com, so people can head over there to get more information and find out more about you and care to know. So thank you for joining me.
Thanks for having me.